So the first view that we'll take of the artery is a cross-sectional view. So starting off horizontal to the patient's neck, it's easiest to find the artery if you start just to the left or right of the center line of the neck. What I usually do is find the bonier structure here, the thyroid cartilage, set the left or right side of the probe right next to the thyroid cartilage, and then lay the probe flat. So you're basically just to the left or right of the center line. And it's always easiest to start very low on the neck. The reason being, you have a lot of brighter echogenic tissue surrounding the artery, such as the thyroid and other muscle and connective tissue. So in most cases, if you position the probe as such, you will see one dark pulsating circle in the center of the ultrasound video, and that is a cross-section of view kind of looking into the pipe of the carotid artery. So you'll start, like I said again, as low as you can on the neck, slowly pull the probe up towards the patient's jaw, and what you're looking for is a carotid, again, is always going to be a dark circle. You're looking for anything sitting inside of the circle, causing it to collapse and not look like a circle anymore. So again, I'm starting very low on the patient's neck, and I'm pulling upwards toward his jaw, keeping the artery in the center of the screen. And as I come higher, the artery will start to open up. So this is the bulb of the artery. And as I come even higher, it will branch and split off into the internal and external carotids. And per the guideline, you want to sweep as high as you can, so until you either lose sight of the arteries or run into the patient's jaw. So sweeping the entire length, looking for lumen intruding plaque. So once you've performed your sweep, if you have not identified anything obstructing the vessel, simply capture an image. I like to take the pictures just below the bifurcation. And now we can move on to make the carotid IMT measurement. So on the IMT measurement, there's three movements that you'll make. The first movement, keeping your eye not on the ultrasound screen, but on the probe and your hand, is simply rotate the probe more or less 90 degrees, keeping the artery mark, this dimple, facing up towards the patient's neck. So again, from this cross-sectional view, again starting low on the neck, once you've identified the carotid in the center of the ultrasound screen, simply rotate the probe 90 degrees so an artery mark points towards the patient's head. More or less, it will align with the patient's neck. The second thing to do is set the angle. So as you can see, while I'm tipping the probe up and back, kind of rotating it around the lens of the probe, the angle guide on the screen is also providing me feedback as to which angle the probe needs to be held. So I'm going to angle the probe in the green zone. And now what's left of the operator is to find the artery. So this movement is simply what they call a translational movement, sliding the probe towards the patient's back and then up towards the patient's jaw. Up towards the patient's throat. And as you're doing this, what you'll see is a very dark stripe jump across the screen. And once you see that, you know you've identified a carotid. Now in some cases there's a question as to, is this or is this not a carotid artery? And you can quickly identify that by looking at the waveform on the bottom of the ultrasound screen. If it looks like a very repeatable pulse waveform, you know it's a carotid. I will intentionally be over some muscle, and if you think you've identified a carotid, just quickly look at the waveform. If it's erratic and not repeatable, you know this is not a carotid artery. So again, simply slide towards the patient's throat and pull back towards the patient's back. And you'll see an artery come into view. As soon as this does, and you've identified the waveform on the bottom, you're looking for this quality indicator to turn from orange to green. As soon as it's green, you will hold still, and the system, as it just did, will capture and make an IMT measurement. Now there's a couple of checks that you will need to make as an operator. The very first check is reference, after it's frozen, reference the angle guide on the bottom right of the screen to make sure that you are more or less in that lateral view of the artery. In this case, the probe is slightly outside of that view. It's okay. However, you can always choose to unfreeze and then recapture the image. So same movement. I'm going to try to find this artery, reset my angle, The second check, which is the more important check, is to see that the dotted line on the left side of the ultrasound screen, this line here, lines up with the widest part of the artery, or at the flow divider if you can see it. So keeping your eye on the diameter of the artery from the right side of the screen, you can see that the artery opens up here. However, it's not quite in the widest part, nor can I make out a flow divider on the left side of the screen. So I'm going to unfreeze it one more time, slowly pull up towards the patient's head, and then get another measurement from this side. Okay, so now the first check is the angle in the correct position, yes. As a second check, is the dotted line in the widest part of the artery? And in this case, I can definitely make out that yes, that is the widest part of the artery. From this view, you're unable to see a flow divider, but again, since anatomy does differ across every patient, you may only see this kind of view or just a widening of the vessel. Once those two checks are complete, the measurement is done. So, as you can see in this example, the system captured the measurement in about 10 seconds worth of scanning. My two checks, one for the angle, one for the bulb on the left side of the screen, do pass. So now we can move on to make the measurement on the other side. So now we've repositioned the patient, moved the angle pillow to his left side, so we're scanning on his right side. Again, to locate a cross-sectional view of the artery, set the probe next to the center line of the artery, next to the thyroid cartilage, and then lay the probe flat. Again, you'll locate one dark pulsating circle, and that is the carotid artery. Again, it's always easiest to start low on the neck, again, because you have a lot of brighter echogenic tissue. Slowly start sweeping the probe up, pulling it toward his jaw. And as you're pulling the probe toward the patient's jaw, you'll see the artery start to expand as it is now. And if I keep continuing, it has clearly split into the internal and external carotid. Again, I'm going to continue sweeping up, looking for any lumen obstructing material, lumen encroaching material, until I either lose the artery or run into the patient's jaw. In this case I have, so I'll again slowly sweep back down, back through the bulb, back into the common carotid. And again, you will want to capture an image of this cross-sectional view. From here, you have the option to go back through 60 frames of a video loop and pick a better image if you did identify one. In this case, the last picture that I've taken is sufficient, so I will now choose the IMT measuring toolkit. Okay, again, the three movements. I've located the carotid artery. It is in the center of the screen. The first movement I make is a rotational movement, so I'm not looking at the ultrasound screen, keeping my eye focused on the patient's neck and the probe. I'm going to rotate the probe more or less 90 degrees so it aligns with the artery mark aligns with the patient's head. In this case, it's already captured an IMT measurement, so I'm going to unfreeze it, and now I'm going to set my angle. So I'm going to set the angle into the green zone, into the lateral view, and I'm going to find the artery, again, by translating the probe up towards the patient's throat. If you run into the bone, you've gone too far. So just, again, simply pull it back towards the patient's back until you identify a very dark stripe jumps across the screen. And this is his carotid artery. So it's taken an image. Again, we'll run through our two checks, the first of which is referencing the angle guide on the bottom right of the screen. In this case, it is the correct angle. The second check, however, is seeing if the dotted line on the left side of the screen falls into the widest part of the artery or at the flow divider. That fails. So I will unfreeze the image, pull up towards the patient's head, and then now that I have identified the widest part on the right, I'll hold the probe still, and as you can see, it captured one more image. And I'll do that one more time. So again, just simply slide the probe up towards the patient's head. You may lose the artery as I've done here, but again, the move that you have to make is the find the artery movement, or this translating movement, until you see the artery come into view. And you'll look for the quality index to go from orange, as it is now, to green. As soon as it's green, wait for 3 repeatable cardiac cycles, and an image will be taken. So now I'll run my 2 checks again. Is the angle in the correct region? In this case, yes it is. And now, is that dotted line in the widest part of the artery? In this case, yes it is. So these are some quick tips to help the CardioHealth station auto-freeze much faster. So again, I'm going to first locate the cross-sectional view of the carotid artery, and I'm going to rotate the probe, keeping my eye on the probe and not the ultrasound screen, so it lines up more or less 90 degrees. Then I'm going to set my angle. In this case, the angle is already set, and I'm going to find the artery. Now in some cases, this may be what you see, where it's kind of an oval shape. This is considered an oblique view of the artery. And what causes this is either an over-rotation or an under-rotation of the probe. And you'll keep your eye on the ultrasound screen, you'll see what happens. If you see this oval shape, the corrective movement to make is a simple rotation, and then find the artery again. And you can see now the artery is aligned across the screen. So I'm going to do that one more time. So in the case where you've located the artery, but it's considered an oblique view, kind of an oval shape, where it's clear in the center of the screen and unclear or fuzzy on the right and left sides of the screens, the corrective movement to make is simply rotating it either clockwise or counterclockwise until the artery opens up across the screen. And in this case, as you can see, I'm rotating it. The artery is now clear across the screen. Autofreeze will occur much quicker, and you're able to locate on the left side or right side of the screen where the widening of the artery is. This is more for reproducibility and future review of the reports. You can quickly see where you were located on the artery when the measurement was made. Whereas if you have an oblique view of the vessel, although you may know you were in the correct spot, on future review, it's unclear as to how high or low on the vessel you were. Another corrective movement that will help the CardioHealth station auto-freeze much quicker is what we'll cover now. In some cases, you may see what I'm seeing on the screen now, where the artery is angled across the screen, kind of higher on one side and lower on the other side. This is either due to patient anatomy. In other cases, it may be due to one end of the probe being pressed in further into the patient's skin than the other. In this case, what you'll see is what I'm seeing on the screen here, very kind of sloping artery across the screen. Although the system will make a measurement, as it is done here, autofreeze will occur much quicker if you can flatten out or make the vessel more horizontal across the screen. And this movement is caused simply by rocking the probe, as I'm doing now, kind of right around the center of the probe. And as I'm rocking it, you can see the artery is angled, and it slowly comes into a horizontal view. And in this case, autofreeze will occur much quicker. Again, this may be due to patient anatomy or simply the way you're handling the probe. You may need to rock it one way or the other, just determining which direction will cause that artery to flatten out. As soon as it's flattened out, again, the movement that you'll make is this find the artery movement, sliding up towards the patient's throat, back towards the patient's back, until the artery comes into view. And then look for the quality index to turn green, and it will take an image. So again, I have an oblique view, this oval shaped view. I'm going to twist the probe so it aligns across the screen. Or in some cases you might see this angled artery, and I'm going to simply rock the probe until that artery flattens across the screen, and again find the artery again, this translating movement until the system captures and makes a measurement. Now again, the two checks that you'll make after every corrective movement is one, to see if you're in the right angle, and two, to determine if the bulb is in view. In this case it was not, so I'm going to simply again slide the probe up towards the patient's head, and I've rolled off the vessel, which is okay, but I'm going to keep the same vertical placement and then find the artery again, and now I can take a reference, make a corrective movement, find the artery again, get my bearings, make a corrective movement, find the artery again, and now you can see the bulb on the left side of the screen. But the artery is a little angled, so I'm going to simply rock the probe until it flattens out. And you can take as many images as you'd like, but the last image that you choose, as the operator, you have the determining factor for quality. So in this case, I do like this image. The artery is nice and flat. I can see it all the way from the right to the left of the screen, and my angle is correct, and that dotted line is in the bulb of the artery. This is the image that I would choose, and simply moving on to the next measurement or back to the main study page will keep that image in memory. All right, man.
All right.
That was it.